Travis Wheeler came into this world fighting for his life.
Travis's heart was starting and stopping. It was that touch and go.
He was diagnosed with twin-to-twin transfusion syndrome. It's a rare and life-threatening condition that causes an unequal flow of blood between identical twins sharing a placenta. Born at 33 weeks, the twins spent days in the NICU. A lack of oxygen at birth contributed to a number of medical problems for Travis, including vision problems. Eventually, he was diagnosed with cerebral palsy.
His left side is weaker than his right.
But that didn't keep him from participating in sports and outdoor activities with Zachary. The twins started playing football in elementary school. Travis was sidelined with seizures at 12, and Zachary played while Travis served as team manager in high school. At the end of Travis's senior year, that work ethic and incredible memory, supportive staff helped him succeed academically. So much so, he graduated at the top of his class, an achievement nobody expected, especially Travis.
I worked really hard to do the best.
You can't let the disability impact them showing you what they know.
It's a good picture.
After graduation, Travis qualified to work with a behavioral health professional known as a BHP. BHPs are trained to work with children with developmental and physical disabilities. Travis, along with his BHP, attended classes at the University of Maine Augusta campus in South Paris. But when Travis turned 21, those services ended. He does have an aide who assists him at home and in the community, including taking walks outdoors. But he needs a BHP to help him go back to college. He's been waiting for one for nearly 2 years, and it's been tough.
An extrovert doesn't sit home alone. An extrovert gets their energy from people.
I need to connect with people to make friendships and have people.
Travis's story is not an isolated one. All over the state, hundreds of adults and children are waiting for services to improve their lives. 21-year-old Maddie McCune is languishing, something her mom, Nicole, says should have never happened.
Nobody wants to take accountability for what's happened to Madison.
Nicole says a state-contracted agency, Pathways, was supposed to put Maddie on a waiting list last year for adult services. Those services included day programs, workforce opportunities, and housing. Nicole found out late this spring that the case manager didn't file the paperwork despite telling Maddie's mom and the agency that she had. Nicole employed people with developmental disabilities at her cafe in South Berwick, named in honor of her daughter. Madison's Cafe closed this summer due to a lack of customers. Nicole filed a grievance to reinstate Maddie on the waiting list in the same place she would have been as if her paperwork had been filed. Recently, though, Nicole was notified DHHS denied her grievance, but did not give a reason. Pathways is temporarily providing a BHP for 20 hours a week so Maddie, who needs constant supervision, can get out of the house and work on life skills. But Nicole worries what will happen to her daughter when that help ends.
People are losing their houses because they have to be home with their kids. They can't work. I mean, people are suffering.
Services in some cases that can save lives.
He had the most beautiful smile and blonde hair.
Karen Stadig shows me a picture of her brother Tom. He was diagnosed with autism and bipolar disorder later on in his life, but his parents made sure he received early intervention at a young age.
They never gave up, and they were told many times to give up.
Tom had limited verbal skills but enjoyed doing odd jobs for his family.
Tom loved everybody. No matter where he went, he would be, "Hi, my name's Tom Adams. How are you?"
When he aged out of school, his parents bought this home where Tom could live independently with help from 24-hour staff. Just under 2 years ago, he began having crisis episodes his staff were not trained to deal with. Despite the fact Tom was qualified to receive inpatient services at a mental health unit, he ended up in the emergency room at a local hospital.
There's no beds available. There's no beds available anywhere in this state.
Tom continued to have more episodes. Each time he ended up in the emergency room. She says her brother was often restrained and injected with several medications. As her brother's legal guardian, Karen called DHHS and other state agencies begging for help.
They're killing my brother in the emergency room, and I need some help. I need somebody to do something.
Karen says Tom had lost 75 pounds when a bed finally became available at the psychiatric unit at St. Mary's Hospital in Lewiston.
It was too little, too late.
Karen says Tom started having violent seizures shortly after he started those visits to the emergency room. She believes the seizures were the side effects of all the medication he had been given. After spending 6 weeks in hospice with his parents by his side, Tom passed away in July. He was just 47. The cause of death? A seizure.
With the proper psychiatric care, I think my brother would be alive today. I know my brother would be alive today.
There's just not enough child psychologists, psychiatrists, behavioral health professionals to be caring for the needs that we have in the state of Maine.
DHHS Commissioner Jean Lambrou says the agency is working to address the gaps in the system, especially behavioral health care. The most recent state budget included funding to move 167 adults off wait lists. But providers say low reimbursement rates have made it difficult to hire and train staff to work with children and adults with developmental disabilities to mental health problems. As of October 1st, more than 1,900 adults are waiting for home or community-based programs, also called waiver programs. But the agency says this doesn't tell the whole story. 2/3 of that number are receiving other services. There's 624 children waiting for Section 28 services and 475 waiting for Section 65, behavioral and mental health care services, and a number of children are on both lists. A class action lawsuit brought about 20 years ago forced DHHS to reduce its list of children waiting for in-home behavioral health care services. Now, as part of the settlement, the state pledged to make sure that no child was waiting more than 6 months for services because it's required by federal law. Commissioner Lambrou says addressing the wait times for children is a top priority. The agency is looking at partnering with the Maine Department of Education to merge programs to develop a lifespan waiver that would provide more seamless services from pre-K through adulthood. But that's not soon enough for Laura Gwynn's 9-year-old son, Dakota. He has a rare genetic disorder and autism. He is developmentally delayed and suffers from anxiety.
He is petrified of children his own age.
Dakota's social skills and independence improved after working with a BHP, but that aide left for a better-paying full-time job. Because of his needs, Dakota actually qualifies for a specialized waiver, which would allow him to work with an aide with a bachelor's degree, and that aide would also work with a clinician. But Laura isn't holding her breath.
My case manager looks me right in the eye and said, "We're not even going to put you on that waiting list. It's never going to happen. There are not enough of those people."
The lack of support is taking a toll on Laura, a former special needs teacher.
And I'm tired. I'm tired. I won't give up. I'll keep doing everything I can.
Aranka Moltolchi's 7-year-old son, Colby, has Down syndrome. He loves to play, and his smile lights up the room. But Aranka struggles every single day.
He has very high needs. He can be very unsafe.
Colby has spent more than 6 months on a waiting list for a variety of services, including a BHP. Services that are key in helping children learn how to function in everyday life. Colby had a BHP who helped him learn how to brush his teeth, dress himself, and go out into the community.
It was life-saving for me. It brought me tools and put tools in my toolbox that I didn't have before.
That aide left for a better-paying job, and being in a rural area, finding new staff has been a huge challenge.
We're told that we could be on these lists for years.
Without a BHP, Aranka, a single mom, can't work outside the home because her son can't attend daycare without support. She says what took Colby months to learn is now fading, underscoring the importance of paying now or pay later.
And investing in children with disabilities is a very worthwhile investment because it means less burden, less weight on the system when they're older.
Meanwhile, as Travis passes his time organizing his extensive record
You're pretty close.
and card collections, his family shares the same fear. All of his friends have finished college and started careers, including his twin brother Zachary. One day, Travis hopes to open up his own sports memorabilia shop, a dream that's been sidelined.
Fulfill himself, and he's just, as it is now, he's kind of trapped.